Good afternoon, everyone. Thank you for joining National Disability Institute's Real Economic Impact Network webinar series. Today, we're pleased to be with you to provide you information on integrating financial capability strategies within workforce programs. My name is Elizabeth Jennings. I'm the Director of Training and Technical Assistance here at National Disability Institute. I will be your moderator today, and I will be taking some liberty at the beginning of today's presentation to frame out some of today's conversation based on some new legislation that was recently passed. Before we get started, I'd like to invite my colleague, Nakia Matthews, to provide you with a few housekeeping tips.
Good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, and if you accidentally close this panel or if the sound stops, you can reopen the audio broadcast panel by going to the top menu, Communicate, Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial the toll or toll-free number you see here and enter the meeting code. Please note you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you'd like to make the Media Viewer panel larger, you can do so by minimizing some of the other panels like participants or chat or Q&A. And conversely, if you do not need the captions, you can minimize the Media Viewer panel. We will have a question and answer portion at the end of the webinar. Please use the chat box or the Q&A box to send any questions you have during the course of the webinar to either Elizabeth Jennings or to me, Nakia Matthews, and we will direct those questions accordingly. If you are listening by phone and not logged into the web portion, you may also ask questions by emailing them directly to Elizabeth at ejennings@ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the NDI website. If you experience any technical difficulties during the webinar, please use the chat box to send me, Nakia Matthews, a message, or you may also email me at nmatthews@ndi-inc.org.
We'd like to give a special thank you today to our sponsors, Walmart, Bank of America, Accorda Therapeutics, the Burton Blatt Institute at Syracuse University, and our longtime partners at the IRS. For those of you who are new to our series, National Disability Institute is a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities and to build a better economic future for all Americans with disabilities. NDI's Real Economic Impact Network is an alliance of organizations and individuals dedicated to advancing the economic empowerment of people with disabilities. The network consists of more than 900 partners in more than 100 cities. And for those of you on the line who are members of the network, we greatly appreciate your partnership. For those of you who aren't yet, we hope you'll take a moment to join the network. Included in that membership are nonprofits, community tax coalitions, asset development organizations, financial education initiatives, private and public sector partners, as well as individuals and families with members with disabilities. We invite all network members to join forces to embrace, promote, and pursue access to and inclusion of people with disabilities in the economic mainstream. The webinar series is designed to support the Real Economic Impact Network members in doing the excellent work they do in both providing services to individuals with disabilities and integrating economic advancement strategies into those services. Today we're going to talk about the implications of the new Workforce Innovation and Opportunity Act, which we'll be referring to as WIOA. It provides some new service provisions that we're going to share with you, the practical application of customer financial assessments within American Job Centers through the Disability Employment Initiative in Florida, the impact of those assessments and referrals from the customer's perspective, a review of a financial assessment tool that is currently being piloted with the New York Disability Employment Initiative in collaboration with the Consumer Financial Protection Bureau. And we're going to try very hard within our hour today to leave times for questions and answers. If we don't get to your question today, please do email me, ejennings@ndi-inc.org, so we can get back to you after today's event. We trust that after today's webinar, you'll have a better understanding of the guidance WIOA offers to integrate financial empowerment services for customers with and without disabilities, the practical application of financial assessment tools and the impact it can have on customer outcomes, and current pilots underway within the Disability Employment Initiative that utilize financial assessment products. To just take a quick moment, the Disability Employment Initiative is funded through the Department of Labor, their Employment and Training Administration, and the Office of Disability Employment Policy to build the capacity of the public workforce system in select states to better serve individuals with disabilities. So we're really very excited today to be able to provide you information on integrating financial stability services within your different workforce programs, whether you're a public workforce center or you're a community-based organization providing workforce services. But we really couldn't have that conversation today without sharing with you a bit about the new Workforce Innovation and Opportunity Act. President Barack Obama signed WIOA into law very recently on July 22nd. It passed with wide bipartisan majority, which is really shows you how favorable it was seen in both the Senate and the House of Representatives. It does some language to affirm the ongoing role of American Job Centers, which in your local area may be called workforce centers or one-stops or go by any other name, but it's those public workforce centers. WIOA promotes program coordination and the alignment of key employment and training programs at the federal, the state, and the local level, so we wanted to make you aware of that. And WIOA also builds on some of the proven practices that have been rolled out across the country in specific areas. And some of those practices are career pathways, different economic approaches, and work-based training. Some of the highlights of the reforms we wanted to point to you today because they can help build some of the work you're going to do after hearing about it today around building and integrating economic empowerment services into the work that you do. So WIOA supports you in a number of ways that you might want to consider. WIOA is going to require that states strategically align workforce development programs to support job seekers and employers and streamline and strengthen the role of the workforce development boards, and we're going to talk about that in just a minute. It asks workforce system to improve services to employers and promote work-based training and to provide access to high-quality training. It's going to enhance workforce services for the unemployed and other job seekers, including improving services to individuals with disabilities. And where we really get into some of the economic support, it asks that there are key investments made in serving disconnected youth and other vulnerable populations, which we're going to talk about today, as well as increase the performance and quality of Job Corps programs and connections with registered apprenticeship programs. So I know that that's very fast, but I really want to be respectful of our time and get us to some of the strategies. But before we do that, just to give you a couple of highlights of WIOA. One is that the provision really focuses on community input. So the new WIOA rules provides a venue for community input and expertise to fortify the planning that's going to go on in each state and at the local level and the service provision at those different levels. So rather than read you what's on the slide, in the interest of time, and these slides will be made after today's event, I want to make sure that you know that the new WIOA rules have asked for people from the field to come and sit on not only their state and local workforce development boards, but also on a committee that's going to advise the Secretary of Labor on strategies to increase the competitive integrated employment of individuals with disabilities. So if you're in the audience today and you would have something to add to this conversation, or you have strategies that you think could be relevant at either the federal level, the state, or the local level, we want to make sure you're aware that your input is being sought. So there's a Federal Register announcement, and the link is there. If, Nakia, you could perhaps put it into the chat box so people can look at it. So if you'd like to sit on the advisory committee at the federal level, which would give you a chance to talk about the good work that you do and some of the strategies you have for improving the employment and economic outcomes of job seekers with and without disabilities, we really want to encourage you to apply. You have to apply by October 14th, so time is ticking. But also there's going to be other opportunities for you to add that expertise to the workforce boards at both the local and state level. And we'd really like to put that bug in your ear for you to start thinking about whether or not that's something you could and would like to do. Another focus of the provision is access. WIOA seeks to increase access to high-quality workforce services for individuals with disabilities, specifically to prepare them for competitive integrated employment. So there's a section called Section 188, which is the non-discrimination component of the Act that is going to be looked at a little bit more closely. WIOA asks that centers ensure both physical access and programmatic access, and one-stop centers or workforce centers or AJCs are going to have to go through an assessment of their physical and programmatic accessibility every 3 years. So this is another area where it may not seem relevant to today's conversation, but it really is, because as we look at different service integration, WIOA reinforces that any consideration of service integration is going to have to include programmatic access for people with disabilities. So this is a nice tie-in as you consider some of the additional economic advancement services that you could provide. Another focus is on coordination, and WIOA requires that there is the creation of what's called a unified state plan. So the unified state plan is going to ask that workforce and vocational rehabilitation, which is specific workforce services for individuals with disabilities, that they have a unified plan in how they're going to cooperate and collaborate between their two systems, and how they're going to make sure that they both comply with Section 188. This is a really important component to those of us in the disability field, because the benefits of workforce and vocational rehabilitation working together are profound. Within these two systems, they can share successes. So if somebody is registered with both vocational rehabilitation and with the workforce system, and they are successful, both VR and workforce can claim success. But also because vocational rehabilitation and workforce provide a different set of services that are complementary to each other and can be very important when looking at the employment outcomes of individuals with disabilities. To bring it back to integrating some of the financial stability services, VR actually has within their parameters the option to pay for different things that an individual would need as they're seeking to build their financial stability or capability. For one, in many states, vocational rehabilitation pays for Social Security benefits planning. And as many of you in the workforce services know, that can oftentimes be a real barrier for individuals with disabilities who want to build their financial capability. But also vocational rehabilitation in some states looks at how they can also further an individual's financial self-sufficiency, and it is within their federal parameters to pay for things like financial coaching. So in your local area, we hope that after today you'll feel inspired to think about some of the ways that you can add your voice to these state, local, and even the federal workforce board, how you can connect with us or other disability partners to ensure that there's going to be access, programmatic access to the financial capability services that are brought in, and also how you can use partners like vocational rehabilitation to support some of the unique needs that the individuals with disabilities might have, or to help pay for some of those services. We also want to make sure you know that WIOA also takes a focus on youth. So WIOA ensures that youth with disabilities will receive extensive pre-employment services, and that's going to be both for youth who are still in school. So in the disability community, we call those transition age youth, who may need a host of disability services when they transition from school or may not. And they also look at out-of-school youth. So youth that have disengaged from their school, maybe they've dropped out, maybe they're not actively participating in school. I'm not giving you the exact workforce definition, I'm sorry, but WIOA focuses on these youth and asks that the state workforce system look at how they're going to ensure that financial literacy education and entrepreneurial training are noted as allowable activities for youth that are in school and out of school. And it also asks that the state vocational rehabilitation agency set aside at least 15% of their funding to provide transition services to youth with disabilities. And if anyone on the line is really interested in delving deeper into this youth aspect, please feel free to reach out to us. We'd be happy to talk to you about it, some of the success that calls for, or some of the success we find in it, and some of the strategies that you could implement around youth. And then we also wanted to take a moment to show the WIOA's focus on financial education. So not only does WIOA ask the state to provide guidance to the state on the use of state funds to provide financial education services to youth, both in school and out of school, but it also speaks to this as an allowable service for adults. So WIOA is saying, please states, use some of your, it's not mandating, but it's giving them guidance that a good use of their state funds would be to provide services around financial literacy. And this language that you see on the screen today comes directly out of the Act. So they note creating household budgets, initiating savings plans, making informal financial decisions about education, retirement, homeownership, wealth building, other savings goals, and the list goes on. And so this is a really wonderful example of the power of policy provisions and what it could mean for you within your local area to have your state provide guidance to the local level on the use of these funds to provide financial education. And it gives some thought to what you can do in partnership with your local workforce board and your public workforce system to ensure that that financial education and financial capability strategies are being woven in to the different workforce services that are provided. So there's a lot of tools and resources that are available to build up your knowledge, and I realize I went really quickly through it, but I'm so excited for Melanie McGill and Kevin Nickerson to share with you how they've already started to implement really part of what WIOA asks for in their current provision of services. So please forgive me if I went a little fast, but we will be providing additional training on WIOA through National Disability Institute, specifically through our LEAD Center. You have the website there, but there's a host of training and tools available online, and we are always here to support you with technical guidance as you should need it. But we wanted to make sure that you had this little bit of understanding about WIOA because it's so important to understand that not only are you showing yourself as an early implementer in wanting to understand how you can start to integrate financial capability services into your workforce systems, but you are now equipped with guidance from the federal level that this is something that the Department of Labor would like to see integrated within the public workforce system. It's something that they're approving states to spend their funds on, and it's something that you can lend your voice to at the federal level, the state level, and the local level. So I'm going to stop there on WIOA so that I can introduce to you Melanie McGill, who's with the Florida DEI program out of Fort Lauderdale. And Melanie McGill has been really an excellent partner to us here at National Disability Institute. We've watched her implement different financial capability strategies within the workforce system that she works in, but she's been involved in various aspects of workforce development for over 14 years. She has extensive experience and organizational skills, which she's used to help CareerSource Broward implement various aspects of project development. She's highly regarded in her local area and by us at the federal level for her effectiveness in strategic planning, program development, training, and her strong leadership. So we're really thrilled to have you join us today, Melanie, and just thank you for sharing your voice and experience to this conversation.
Thank you, Elizabeth. I think I'll take you on the road with me. That was a very nice introduction. So what I wanted to talk about today was how we started to integrate financial assessment and financial capability into the one-stop. So one of the things under the DEI grant in Florida, one of our areas that we chose was asset development. We partnered with NDI, and we had two technical assistance people, Michael Rausch and Katie Metz, who have been wonderful. So we started training in 2013, and we always think we do really well at what we do, but we noticed that there was something missing. So one of those light bulbs went off, and I said, okay, we need to incorporate asset development, and how do we do that? The first thing we did was we incorporated 2 questions on financial health in our intake form. When I have staff that work with customers that are on disability in the Ticket to Work program. So we figured, let's start in our little bubble. So we added those questions into the intake form. We borrowed, I won't say stole, we borrowed NDI's financial intake worksheet and incorporated some extra questions and put our logo, put their logo to give them credit. And we did that with the financial intake worksheet, the weekly expense tracker, and when opening a bank account questionnaire. We trained all our frontline staff on asset development. So that's the Welfare Transition Program, the Workforce Investment Act programs in our centers. So all the staff in our centers were trained on it. We added Money Smart as an allowable Welfare Transition Program work registration component. So anytime somebody in the Welfare Transition Program in our state needs to do work registration, that's one of the components that they can do. So as you can see here, here's the financial intake worksheet. It has our logo, it has NDI, and this is an Excel spreadsheet. So all they have to do is put in the income amounts, the expense costs, everything will add up, and it'll give them the differences at the end, where it says total monthly income, total monthly expenses, and the difference. So if it's negative, you have more expenses than your income. If you have a positive, that's a good thing. And what are you going to do with that money? Where are you going to put it? So financial worksheets like this can help all the customers and our staff. This was the tracker. So if somebody, getting back to basics, if somebody really doesn't know where their money's going, how many of us really know how much we spend each day on different things, this was a way to help our customers to look at what they were spending their money on. When opening a bank account, this was questions that they could use to interview their bank. We interview people when we want to hire them, but we also need to interview our banks to see what kind of charges are going to be charged, what fees are there. So this was a way to help them do that. So then I said, okay, how can we do this better? We always want continuous improvement. So we went to another training in 2014, and I said to Michael Rausch, who's my technical assistance person, what else can I do? So what he suggested is taking some more of the questions that we learned and adding a whole financial section to our DEI Ticket to Work intake form. So why do we decide to do this? Well, first I want to show it to you. So these are the questions that we're asking now on our intake form. It gives us a way to start that conversation with the customer. How many people are comfortable talking about their finances? So when my staff looks at the form, they could see how the customer answered the questions and what could be their next steps, where they can refer them, how can we help them, what other agencies in the community can we work with. So we embedded this information into our form. Again, we need to start that dialogue. This way, adding those questions into your intakes can do that. So it makes people feel more comfortable. It's not always easy for customers, staff, to discuss their finances because it is a personal thing. Maybe if we can get people to start talking about it, we can actually help them increase their income. It's just like people talking about a disability. They're not always comfortable, but we found that they were even less comfortable talking about their finances. So what did we do? Some other resources that we had. We put Money Smart in all our resource room computers. Every resource room that we have in our centers, we have 3 centers in Broward County, has the Money Smart on them. We actually just went to a training yesterday in order to incorporate a Money Smart workshop into our centers as well. We do referrals to the Work Incentive Planning and Assistance Program, which in Broward is, our person is 3 hours away, so it's not as convenient. We refer to agencies in the county, for example, United Way, and we refer to the VITA sites. So I wanted to talk to you about a success story that we had. Albert was a customer that came into the One Stop Center. He was originally on extended unemployment compensation. So he was unemployed for 8 months. And we found out that he had a disability. So one of our disability success coaches started to work with him. At intake, they found out that he was unemployed, and his last employment was as a material handler for a pharmaceutical company for 7 years. He was a single parent. He was utilizing public transportation, but he wanted to really save for a car. So that was the financial piece that we needed to know. How can we help him now save for a car? The customer needed other resources to help him get a job, so we sent him to a community agency to help him get a bus pass for the time being. He was also referred to the resume workshop, social networking workshop, and on-site recruitment events that we hold in our centers. He ended up obtaining employment in June 2013 as a warehouse material handler, because that's what he wanted to do. He wanted to be a material handler. And we know with our customers, sometimes when they have their mindset on something, that's what they want to do. So we worked with him to get him that job. And then what we did is we referred him to the Ways to Work program with Urban League of Broward County. Unfortunately, he had to be working for at least 3 months. So we said to him, please come back. Let us help you. We'll help you through the process. So our customers aren't always that great with follow-up, but he did come back. He came back in November. We referred him to Urban League, and he registered online in December of 2013. He attended their orientation in January of 2014. In March, he was approved for an $8,000 car loan. He purchased his vehicle, and he's still working, and he's making all his car payments on time. So now he has another goal. He wants to purchase a townhome, so we're going to help him do that. I just found out recently that one of our staff people went through the same process and was just approved for a car loan. So it can work with your staff members, and it can work with your customers. So is financial empowerment just another job task? No, it's something that can be easily incorporated into your programs. We want all our customers to be self-sufficient, and incorporating financial stability will help increase their chance of reaching that goal. Without some of that discussion, your customer's financial future about your customer's financial future. We are not providing a holistic service and setting them up for failure. Most of the time, a lot of our performance outcome measures one of the measurements is retention. So in order to do that, we have to ensure that our customer's financial future is solid. I hope I was able to explain to you how we incorporated financial empowerment, financial education into our system.
Great. Thank you, Melanie, so much. We really appreciate your you sharing your experience, and we have had some questions come in, so we'll get to those at the end. And if you're on the line and you have questions, just put them in the Q&A box, and we'll call them out at the end of the webinar. So I now would like to introduce my colleague, Kevin Nickerson. He's the Manager of Financial Empowerment and Employment here at National Disability Institute. And Kevin comes to us with a few decades of experience providing employment services to individuals with disabilities, as well as benefits planning. He led the State of New York's Disability Employment Initiative and has done a really exemplary job of showing how you can integrate some of these strategies within the public workforce system in New York. So thank you so much, Kevin, for agreeing to share your New York DEI pilot with us today.
Well, thank you, Elizabeth, and for that awesome introduction. And I'm glad you're with us here today, folks. And to give it a little more context, and Elizabeth did a great job talking up front a little bit about DEI and what this is, but I wanted to just talk about this a little more and where we're at today. Disability Employment Initiative, it does build on previous projects within our public workforce system to enhance services and supports for job seekers with disabilities. Now, this is really the next generation of grant funding to build the public workforce system's ability to serve folks with disabilities. And others you might have heard of are the Disability Program Navigator Initiative, and if you want to go back even further, there were other grants such as the WIG grants, Work Incentive Grants, and so forth. So there's been a lot of experience and opportunity to explore different service strategies over the years. The goal of DEI, and this is something Elizabeth did mention, is to improve the education, training, and employment opportunities and outcomes of youth and adults with disabilities who are unemployed, underemployed, or receiving Social Security disability benefits. There are a number of core requirements of our DEI projects, one of which is to operate employment networks under Social Security's Ticket to Work program. That's why Social Security beneficiaries are specifically mentioned there. To the right, you can see where we're at currently with our DEI grantees. There are a number of states involved now. Actually, there are 6 new Round 5 states that just got announced within the last week or so we're excited about. Again, that's Round 5 of the DEI projects. Currently, though, just so you don't have to do all the math there are now 28 projects that reside within 23 states. And there's more information if you want it, and I'm sure Nakia can help put this in the chat box at the DEI website, dei-ideas.org. Lastly, I wanted to give further context that a number of projects we talked about, there are some core requirements of the DEI state projects, but there are some optional strategic service delivery components that they can choose, each of the state projects could choose from, one of which is asset development strategies. And what we've discovered is that while it is optional, most of the states did choose asset development as a strategy. So that kind of gives us the context as to why DEI, there's 2 projects here that have been talked about in Florida, and this is from New York. And to give you a little further context about how I fit into this, Elizabeth is correct that I was the DRC state lead for our Round 1 project in New York. We currently have a Round 4 in operation now, which it was a pleasure to serve as their DRC state lead. And so this leads us into what we started really last year, a journey with the Consumer Financial Protection Bureau to develop a product that we could pilot both in New York, and actually California was being targeted for this too, and still is. I guess the point was that we were trying to find a practical way to incorporate financial capability resources and strategies within our project, because I wouldn't say that this is woven into the fabric of our job centers at this time, and that's certainly where we would like it to be in the future. So over the last year, the New York DEI State Project and CFPB have been working together to develop this financial assessment tool, and it's sort of a primer. It was modified greatly to meet the needs of our project in New York. And in fact, I enlisted the support of 3 of our DRCs to spend a lot of time and effort to look at this tool and really think about the questions we wanted to address in our project through this simplified product. Now, CFPB has a more complete toolkit called Your Money, Your Goals, and I'm sure a number of you on the call today are familiar with that. Embedded in the PowerPoint here for you to look at it more closely if you're not familiar. And the motivation was simple. Again, a number of our projects chose asset development as a strategy. And so we were looking really for a way to create an approach to engage customers and in a simple way that could be adopted not just by our project, but we'd hoped for all of the staff members at our centers in the future. So again, if I look at kind of where we came from and where we've ended up, I wanted to kind of talk more about the goal. When you look at the Your Money, Your Goals toolkit, it's kind of daunting if this is not the world you reside in terms of providing financial counseling. And certainly that's the case for many of our center staff and for the disability resource coordinators that work in these projects. So what we needed to do was really develop something that was a lot more concise. Not that that isn't a great product, but we had to start somewhere. And I'm a firm believer that when we keep things simple, people will use it. And so that was the goal. That was what we wanted to achieve, and that's what we did. We started with this really thorough product and kind of drew from that some of the pieces we thought were most useful. And again, why we did this, it's simple. We needed a primer. Melanie has mentioned, and it's so true, I mean, people and I'm sure most of you know, people don't really want to talk about their finances any more than they want to divulge that they have a disability. But when we start this conversation, it's kind of interesting to see where this can take us. There were some goals that we had for this product that we wanted to see achieved eventually. Again, I'm going to reiterate this, that it was to begin that important dialogue with our customers, which, again, isn't really normally occurring, but what we want to see as a normal part of the service flow for our customers. We eventually would like to expand its use to all the state DEI projects, and we're really on that path now. We've been refining this, and we're close to a complete product here soon. It does provide us a baseline for asset development implementation. Not that this is the only strategy that should be employed or is employed by state DEI projects, but it's some place to start. Because many of our DEI projects do struggle with, where do we begin with this? This is such a big topic, and it's hard to know where to start. One of the other things when we started developing this is we realized that it's good to have certain questions. I'm going to show you actually in the next couple slides here a sampling of the questions we asked, not all of them, but some of them. But one of the things we like about it is it really did require the DRCs to research local resources in order to be able to make appropriate referrals. So it really allowed them to understand what's going on in my community and what can I provide as far as referrals and resources to customers once we do go through this process of using this tool. So it really did increase the knowledge of the local resources that exist for folks that are using this tool. There are a number of, in terms of where this gets implemented, or when I should say, in terms of customer flow, I wouldn't say that's completely sorted out. I think that's flexible, but certainly we were able to point to some folks that we serve, especially under DEI. I mentioned that any of the DEI projects have to serve as employment networks. So certainly anybody that's involved with the Social Security's Ticket to Work program that has a formal individual written plan, work plan, that would be an appropriate place to use this. But that's not the only place we were looking, and nor will it be the only place that it is used. But there are a number of places that I'm sure each of you that are on the line today could point to say, well, that just makes sense to fit it here in our customer flow. So the official title of the tool we created, actually CFPB had this title already in their toolkit, is the Customer Goal and Financial Situation Assessment Tool. For short, I just like to refer to it as our financial assessment tool. But here are some of the questions that we have in this tool. And again, this is not the final product. I just kind of pulled from one of our drafts that's close to being finalized. In fact, it should be this week. If folks wanted to see this, we could provide it shortly. I love this first question that we added because it really sets the stage, which is, well, most people have their own idea about what it means to be financially stable or secure. What does it mean to you? And again, I think that really sets the stage for us to speak to customers about what their expectations are for their life and what it means to them to have financial security. And that gives a different kind of context to the next steps that we would take with any customer, because everybody has different goals. But certainly when we do get to the dreams and goals of the customers we work with, that's where the real results come from, I think, the real progress that we can make with customers. The next is about, their particular financial goals and how much they need to have saved to reach them. This certainly, goes to, kind of job development goals that we might have with a customer based on their own particular savings and earning goals. Some of the other questions you can see here talk about resources that folks may or may not be, accessing or have access to, such as, transportation and so forth. And whether or not folks can cover their bills and expenses. Again, all these things kind of lead to employment-related goals, don't they? So they're all kind of tied together. Some of them lead to resources and other referrals that we would connect folks to. So these few questions, and I think I have another slide here that shows a few more. If it will move, there we go. So here's a few more questions, but. And I think there are a total of 15 that we pulled together for this product. But we also asked about other programs and supports that folks may be accessing, and really that should be, and I think we did change that to SNAP. It's not food stamps now, but some people actually, the customers really understand it best by some of the older terms. But, what kind of resources do you have in play right now? And, we talked specifically about are folks worried about having a job or saving money that'll affect eligibility for SSI or disability and or other public benefit programs. This and New York is kind of unique in the DEI world in that we are one of a handful of states that chose to have our disability resource coordinators certified as Social Security benefits and work incentive counselors. So they have a pretty tall order there in New York to keep track of all these things. But because of that, it was important for us to kind of assess what is the level of knowledge that our customers have around these benefits, because if we see a fear about work and benefits, certainly we know that that person needs more intensive work incentive counseling. So it really informs our next steps in so many ways with our customers and helps us to understand the kinds of additional resources and services that they need. That's the point of this, of course. Some of the questions at the bottom here talk about more immediate needs and concerns that we could connect people with locally. And that's, again, why we have to have a really good sense of what the local resources are, who we can go to in the case of these kinds of immediate needs and emergencies. What's also nice about this tool is that CFPB has provided a number of quick tips in this that were customized for our use, and which are also included in their larger toolkit. So it's a really nice product. But it's been very much condensed to, again, be just that primer that can start the conversation with our customers that isn't necessarily being built into the fabric of our services in our centers currently. So what value was added in terms of this service? Well, I gave you kind of history and background and how I was involved, and now we have a round 4 in New York, which is exciting. That they're carrying forward some of the work we've already done in years past. And it's been fortunate for us to be able to carry, again, this idea forward with the round 4. And so this year we were able to do some testing with this product, and I want to just give a shout out to the new DRC state lead in New York, to Jerry Walsh, who I'll mention a number of times in the next couple of slides here. But she really helped to test this product and put it in front of customers along with I think it was mainly Jerry, but there was maybe DRCs involved too. But there was a small sampling of customers that we used the initial product with, just to kind of get a sense of what people thought of this and to help further refine the questions we might ask in this tool and to develop the final product, again, which I told you should be done as early as this week. One of the things I really appreciated about this was it did inform us about a lot of things that we needed to change, and it told us a number of other things too. But Jerry was kind enough to provide me an overview from one of her customers that I kind of put together in a story. She gave me a lot of facts about this, so I kind of put it together so I could read it so I didn't miss any of the key points. And this story is about someone we'll call for today Kay, and I really appreciated what happened as a result of the use of this tool. So I'm going to read this story to you. So Kay was first engaged by Jerry, the DRC state lead, when she called to make an appointment. Kay was referred to Jerry by another AJC staff member. Based on the phone conversation with Kay, Jerry could tell she was comfortable sharing information, which was a plus. And Jerry asked if she'd be willing to review some information about her financial circumstances, which she agreed to do. Jerry spent about 45 minutes with Kay during the initial meeting, reviewing the information in the financial assessment tool, and discovered a lot about her current financial situation. She also learned that Kay was 60 years old and was receiving Social Security disability benefits and seemed motivated to improve her financial circumstances. Jerry also discovered that Kay did not have a bank account and was paying $30 every month to cash her disability check and had a student loan in default. Jerry invited Kay back for a second meeting to review the recommendations she identified based on the responses Kay provided. Jerry used her knowledge of local resources and the tips that CFPB included in the assessment tool. It was at this meeting that Jerry learned that Kay had taken her advice already and had already gotten a bank account. Jerry pointed her in the right direction for assistance with transportation costs and suggestions to also stretch her food budget. In addition, Jerry also directed Kay to a financial coach that she can connect with for one-on-one support and case management. While this example is still unfolding, Jerry shared with me some lessons she learned by using this simple financial assessment tool. The first of which was, a person needs to be ready to share this information, but offering the opportunity is the only way you'll find out if that's the case. The second was that you have to offer this opportunity to review finances with customers more than one time. It may be that someone will be ready at a later date. And last, finally here, it's easy to come to the table with our own preconceived notions about people and finances. That's why having a formalized tool keeps us from overlooking questions we may not ask. In this example, Jerry shared that without the use of this tool, she never would have thought to ask this customer, based on her age, if she had any student loans. And the truth is, I'm sure I wouldn't have either. So this simple financial assessment tool doesn't cover everything that we need to with a customer, but it certainly begins an important dialogue that can lead to action items that can immediately help to improve the financial circumstances of our customers. And I believe this story of Kay really illustrates how quickly some of these things came about because of this intervention. So what we learned is we have something exciting here that we want to carry forward. In fact, we want to expand its use to all of the DEI state projects. And I just want to say one more time, I appreciate the support of the New York project especially in developing this tool, and I hope this was helpful. And with that, I'm going to turn it back to Elizabeth.
Thank you, Kevin, so much. We really appreciate that valuable input, and thank you to the folks in New York for being so willing to do this pilot with CFPB, and of course to the DEI folks in Florida for testing these new strategies that have been put forward to them. So I want to take a moment to invite everyone to put their questions in the Q&A box. We do have some that have come in, so I'm going to go ahead and get started. The first question that was asked is one that I'll go ahead and take. The question is, regarding WIOA, should the state be outlining the relationship between local WIBs and vocational rehabilitation and providing that to local WIBs, or does each WIB work with their local VR to outline the relationship. Is there a resource that we should be looking to? And that's in relationship to the Unified State Plan that we referred to earlier. So one of the things that happens when something like WIOA is passed is there's a period of time where the Department of Labor writes some additional guidance to kind of clarify some of the things that are in the Act, and that guidance hasn't been completely shared yet. So there should be more guidance coming, but it is a state-level unified plan, so that does infer that the state will be the one leading the conversation. And we at National Disability Institute, through our LEAD Center, we are putting together a sample of what some states who have previously done unified state plans, some of the positive outcomes they've had, and some examples to help guide that conversation at the state level and then at the local level. The next question is, I'm a DRC, which is a Disability Resource Coordinator. I can safely tell you that center staff members are already expressing discomfort in starting a conversation about disability. I know they will show resistance in beginning a conversation about individual financial situations. Kevin and Melanie, can you each provide some suggestions or opening lines that you think help ease the comfort on both the side of the counselor and the side of the customer?
Ladies first, Melanie.
Okay, thank you, Kevin. One of the things that we did is we trained all the staff together on asset development. So they learned it together. They didn't feel like they were just isolated in the conversation. We spoke to them about asking the questions, not even asking the questions, having them just fill out the form. So that way there wasn't any uncomfortable feeling between the customer and the staff. Once we looked at the questions, then we were able to start the conversation. Okay, you don't have a bank account. How come you don't have a bank account? What's happened? Is there something we can do through Bank On to maybe get you another bank account? It's much easier than you think it will be. I know staff sometimes have a pushback to doing new things, but I think we have center meetings in our centers, so that's where we brought it. We brought everybody in. We did a session in the morning, we did a session in the afternoon, so everybody could attend. And I think that's the way to do, is bringing everybody together, explaining why we're doing this. They need successful outcomes for performance. So in order to get that successful outcome, get the placement, get the retention, this was one of the tools that we were using, and I think that's how it helped.
Great points, Melanie. You know, I have to really think back, you know, having been involved since the beginning of the DPN project, and I think back to those days where there was resistance even, I think, in the thought of serving folks within our centers that might have experienced a disability. So, yeah, I think, as you stated, Melanie, change is difficult for folks. And so, but to the point, to the question, you know, how do you incorporate this? I think the best way is as Melanie did. She put this in their intake. She put a question out there. And frankly, I think that's the easiest way to get this started, is to ask, would you like more information about financial resources that could support your employment goals? I mean, why not just ask the question? I think Jerry's experience really taught us that you have to ask to find out if people have interest. If we're not asking the question, we don't know if that's uncomfortable for a customer. She found out with many of the customers she tested this with that they were happy to have somebody care about their personal finances and somebody that could direct them to resources that they didn't know about. So I think the other thing I think of off the cuff is that during, you know, meetings and orientations with customers, that this isn't targeted to any one person, but that it's mentioned as a resource at the center, that if people have interest in that, again, you have to invite people and let them decide. Is this optional? It's, you know, I don't think we have to make this mandatory or want to, but I think if we put that out there and this opportunity exists for customers, we'll be surprised that a number of people will latch onto this and be excited to have an opportunity to learn more.
One more thing is that I think you should look for who your technical assistance person is with NDI, and they can help you deliver that training. They have a great training in asset development, and they could be a partner to help you do that.
Thanks so much, Melanie, for that plug. Kevin, just before you leave this conversation of starting the conversation and using the financial health assessment, we did get a question that asks how you got that financial health assessment, and if you could maybe take a moment to clarify the pilot and what a possible dissemination of that tool might look like after New York and California.
Sure. Well, I'll tell you, we've been in process for quite a while with CFPB to refine the product, and in fact, I was expecting to get this as soon as today to give screenshots of the final product, but it's still in the CFPB shop getting sort of a facelift, so some of the technical features work, because it's a form field. It actually works as a form. But certainly when that's completed, our next step is to implement this throughout all the DEI projects and offer this as an opportunity and a tool for them to use to move forward with their asset development strategies. Could this be available to others? Absolutely. I see no reason why not. I'm sure that probably the easiest way at this point would be to connect with any of us at NDI, Elizabeth or myself. And Nikki is welcome to put my email there if she'd like. And you can just kind of stay in touch with me as we move forward so that when it is available, I'll know if people have interest. I don't see a problem with sharing it. I hope that answered the question. If there was more, let me know.
Great. Thank you, Kevin. So I think this question is really for Melanie, and then Kevin, please feel free to add in. But Melanie, how did you get your leadership to agree to do this work?
Well, one of the things that I could say is Mason Jackson, who's our CEO, has always been a great supporter of serving customers with disabilities and the DEI grant and anything that we need to incorporate. Since it was part of the grant, he saw no problem doing this, and especially with WIOA coming out, I think it's a great place now to start having that conversation, because it is something that they're looking to have all the centers do, all the workforce boards. So I think that's the hook that you may have right now, but showing that, and I hate to tie everything back to performance, but how could it help you achieve your performance in the centers if the person who asked was workforce development? But everybody usually has goals, so how do you, tying it back to the goals of the customer and achieving performance, because sometimes performance is tied to bonuses, not individual bonuses, I mean state bonuses, state incentives. So tying it back to how are we helping the customer as a whole? What are we doing to help that customer? We have to get them employed. What do we do to do that? We provide hard skills, soft skills. We provide workshops. This is just another piece of the pie. And I think we have to look at it as a piece of the pie, not something else.
I will just add to that thought, Melanie, which is excellent. I'd be remiss if I didn't give New York DOL credit for really supporting the advancement of this product in New York. I will say that DEI really helped to become a springboard for this to be launched because of its tie to being one of our goals under the initiative. But what our hope is that through the modeling that the DRC's disability resource coordinators can provide to staff in the centers, they'll see the transferability of this idea, and that this really does translate to all of our customers. And as Melanie stated, for staff too, many folks are not so well versed in these matters. So it really has to start somewhere, and I think you just have to find the place to anchor this and where it makes sense.
Thank you so much, Kevin. So we're going to take just one more question, and that is that folks asked how they can connect some of the technical assistance and the the worksheets that Melanie referenced. So we hope that you'll reach out to us here at National Disability Institute. The budget worksheet and the financial assessment are not at this time on our website. That was provided to Florida through an on-the-ground train-the-trainer that the state of Florida provided funds so that we could provide that to the different disability employment areas throughout the state of Florida. But if you'd like to talk more about the financial tools that we can provide to your local area or some support that we can provide, please reach out to myself or Kevin Nickerson or the third member of our training and TA team, which is Michael Roush. We'd all be happy to support you and talk to you about some of the efforts that we have moving forward and some of the resources that we can share with you. Also, keep an eye out for some of this WIOA implementation. If you want to stay in touch on that information, please check out the resources we provided or join National Disability Institute's LEAD Center. It's leadcenter.org. I also want to take a moment just to ask you to join us for our next webinar. It's going to be on the financial capability of adults with disabilities, findings from the FINRA Investor Education Foundation 2012 National Financial Capability Study. We at NDI took that data and pulled out the disability question, pseudo-disability question that was asked, and then we mined the data from there to demonstrate the deep disparity that that takes place within the disability community in regards to access to financial services, use of financial services, and general financial capability. So we'll be providing that to you Wednesday, November 5th at 3 p.m. Eastern. And if you've missed a webinar that we've done in the past, our archives are available to you. Just check them out at realeconomicimpact.org. I want to say thank you again to our sponsors, Walmart, Bank of America, Accorda Therapeutics, the Burton Blatt Institute at Syracuse University, and IRS. And a very special thank you to Melanie McGill for joining us today. We really greatly appreciate you sharing your expertise with us. And to my colleague, Kevin Nickerson and Nakia Matthews, thank you to both of you. If you haven't joined us before, we hope you'll learn more about us. It's realeconomicimpact.org. You can find us on Twitter, Facebook, YouTube, Flickr, and Tumblr. We are here to provide you with a range of financial capability strategies that you can integrate into your workforce, disability services, or how you can provide deeper support to people with disabilities to engage in your asset development services. With tax time coming up, we hope you'll reach out to us on how you can support your tax work and become a My Free Taxes user. And we hope you'll continue to join us for other strategies every month on the, is this the second Wednesday of the month, at 3 p.m. So thanks so much, everyone. Thanks for joining us, and we'll look forward to speaking to you next month.